Thank you, sir. I was actually asking for a blue card, but I will go on to my speech instead. This seems to be the tip of the iceberg. This looks like EU harmonisation of healthcare systems, clearly by the back door, but using pricing of drugs as the mechanism. Well, can I just point out that there's a huge difference between the insurance and privatised based model of healthcare prevalent in most of Europe versus the contributory taxation based National Health Service model that we have in the United Kingdom. And I'm not at all sure that this step that this seems to be being launched won't represent a disastrous threat to the quality, cost and provision of UK healthcare services. And my voters and my citizens don't want that. I think we've got to stop blaming the elderly, if you don't mind. Many of the chronic healthcare conditions that create the demand are coming about because of lifestyle choices by patients, by individuals of all age groups. And we need to do more, if we're going to do anything at all, to tackle the source of those problems and actually start talking about the business interests and the lobbying companies that actually push the products and create the environmental factors that create the illnesses and the problems for the EU. But can I just finally point out, if you cannot control your borders, if you cannot control your population, if you cannot control demand, you will never ever be able to meet supply. And so if healthcare systems can't plan because they don't know the number of patients, they don't stand a chance.